Good morning. Here to talk about head cancel virtual reality for rehab of 6 nerve palsy. This is a pilot study. It was funded by the AAO Clinical Research Award. And I want to acknowledge my collaborators, Lynn Greenspan, Caitlin Jordan, Gong Liu, and Manarshjot Singh. He's a postdoc engineer in my lab. So, 6 nerve palsy is caused by a variety of different causes. It can be in the young or the old, and it affects the alignment of the eyes, and more specifically, it affects the abduction of the affected eye. So the patient will have crossed eyes, double vision causes visual disability, and there's 2 times greater fall risk in the elderly who have strabismus, this type of strabismus, and others. In a lot of cases, it recovers on its own, but when the brainstem is affected, more than 60% continue with some level of 6 nerve palsy long term. Repetitive oculomotor range of motion exercises are sometimes recommended to help recovery, but evidence is very limited, so we wanted to put this to the test. One of the criticisms of the therapy is that the eyes are always moving in daily life, and so there's no rationale for oculomotor therapy. So to put that to the test, we develop a hypothesis that there's an oculomotor disuse syndrome. This isn't really a novel idea. We know in children especially that they'll adopt a head turn, and that by turning the heads they may not move the eyes as much. This might be similar to disuse syndromes that we see in stroke and upper extremity hemiparesis, but it's never been studied. So the lack of eye movement could lead to further atrophy of the affected lateral rectus muscle and contracture of the antagonist medial rectus muscle. And so if our hypothesis is supported, focused sessions of oculomotor range of motion exercises might be helpful to prevent these secondary problems while also encouraging reinnervation of the lateral rectus. So to do this, this is a pilot study, so we evaluated a number of different technologies. We eventually settled on Pico, which was quite inexpensive. And what's new about the technology is it has integrated eye tracking and head movement recording. And so we could measure the eye movements in real time and also provide therapeutic intervention. So we're basically using the same system to evaluate the hypothesis and to evaluate the treatment. So the idea of head canceling is that by canceling the effect of the head movement, the patient must move their eyes to accomplish the task. And so what we expect to see, or what we hope to see, is that we'll see more eye movement under the head canceled mode as compared to the head active mode, and so that's a within subject's design. We had 2 tasks. One was a transpositional task, which was meant to be realistic, and so similar to what they might be doing in their everyday life, putting coins into a piggy bank, wishful thinking, I guess. And also a saccade task, which is sort of similar to what might be done in the clinic in terms of doing the therapy. So some of the challenges we had to overcome, or we had to address. Eye tracking VR is not designed for people with strabismus, and so we didn't know how the calibration modes would go. And we had to come up with a whole a protocol for doing that didn't exist. We had to develop the software, obviously. We need to see if the field of view is large enough, or what severity of nerve palsy could we enroll, because at some point they'll be looking outside the field of view of the VR goggle. We didn't know if similar sickness would be an issue, and of course we need to be able to recruit volunteers. So that's really kind of where we're at. Here's the very early results. We've had enrolled 4 subjects with 6 nerve palsy. We developed those calibration methods, which included calibrating the non-paretic eye first with an IR patch on one side and then switching it over to the other side for the testing. So you can't calibrate an eye that can't move across the entire motor field. So we did have a calibration problem in 2 where we just couldn't get tracking with the Pico system, so we have data on 2 patients with 6 nerve palsy, and we have control data on 5 at this point, and we're planning to enroll 20 in total. So in those 2 patients, as hypothesized, we're seeing a lot more head movement in the 6 nerve palsy patients, is what you see in the blue, and the control is the orange, so you don't really see much head movement in the normal patients. They're moving their eyes, not their head. In the transposition task, we see a huge difference here. This is raw data, saccades. This is under head active, and then this is under head canceled in the pretic direction. So we see a lot more eye movement under head canceled, and even in the saccade task, we see more eye movement towards the paretic side under head canceled. So if you want to try simulated 6 nerve palsy, we created a module, and you can stop by the poster on Thursday at 4:30. I'll have the headset there, and you can see what it's like to have 6 nerve palsy. Thank you.